right, y'all, let's give it up for Andrew, please. Ready when you are.
So who here has been to the hospital and has worried about what kind of bacteria could be laying around during your stay? Well, methicillin-resistant Staphylococcus aureus, abbreviated as MRSA, is one of the most aggressive and prevalent bacteria in first world countries, which is very surprising. But so, like I said, it's very prevalent in first world countries, which means that you or someone you know probably has come into contact with MRSA at some point, maybe at like a hospital or just during their daily lives. Bless you. So I've worked at various hospitals and interned at various hospitals, so they've trained me on how to best treat MRSA or someone who could be potentially infected with MRSA. So what I want to do is to educate as many people as possible regarding MRSA so they can keep themselves and those around them safe. First, I'll talk about what MRSA is. Second, I will discuss how it is spread and symptoms to look out for. And lastly, I will discuss different treatments and prevention of MRSA infection. So what is MRSA exactly? MRSA is responsible for numerous difficult to treat infections, such as can range from minor skin infections to pneumonia or meningitis, which you can pretty much die from if it goes on for an extended period of time. So what it means by antibiotic resistance means that it is resistant to most common antibiotics that we prescribe to patients, such as methicillin, amoxicillin, penicillin, oxacillin, which is very dangerous because it disrupts the structure of antibiotics, which is very important because the structure of antibiotics is what makes it so effective against a wide variety of diseases. So according to a 2014 article called MRSA Spreads in Households by Mahusudin, she quotes a microbiologist from the Columbia University Medical Center who said that I found that nearly 2/3 of my bacterial samples either fully or partially were resistant to antibiotics that were often prescribed to patients for routine bacterial infections. In other words, it disrupts the structure, which means it makes it less effective. So by studying and understanding MRSA, you can see how it is spread and different signs and symptoms you should look out for. So MRSA is typically known as bidirectional, which means that it can be spread from humans to animals or animals to humans. So it can affect a wide variety or a wide range of animals such as humans, companion animals, cats and dogs, bats, parrots, horses, and pigs, which makes sense because it is commonly spread from livestock to farmers and from the companion animals such as pet like a cute little puppy to his or her own owner. So MRSA can appear anywhere in the body, and common sites for MRSA infection are the buttocks, the legs, the groin area, and the back of the neck. And typically you see a red, swollen, and it's typically pus-filled, which looks very similar to a spider bite, but it's very different. So fair warning, it's a very graphic picture if you guys want to turn away, but that's a site of MRSA infection on someone's lips. So common symptoms of MRSA are pneumonia, difficulty breathing, dizziness, confusion, or chills, and it is almost always accompanied by a very high fever. So treatment of MRSA can be very tricky because it can be a very simple case or a very difficult case. In a very simple case, the doctor would drain the abscess and then just treat it with typical antibiotics. In a more difficult case, he or she would have to drain the abscess and then apply different antibiotics. But at that point, it's just they try whatever antibiotics they think might work. It may or may not work, you never know, and it's typically a very long process. According to a research article written in 2015 by Tong, Davis, Eichenberger, Holland, and Fowler, it's called Staphylococcus aureus infections, epidemiology, pathophysiology, clinical manifestation, and management. They state that all patients with uncomplicated cases should receive at least 2 weeks of IV antibiotics. In other words, most patients should receive at least 2 weeks of antibiotics, and for a longer period of time with different antibiotics if it is a more complicated case. So that's another picture. It looks very similar to a spider bite, but it's very different, as you can see. So we've all heard that the saying that defense is the best offense, right? In the case of MRSA, it's very true, because the best way to avoid infection is pretty much not to get it in the first place, right? So best ways to prevent it are proper hand hygiene, like washing your hands very often, wearing protection for your hands, gloves, wearing like a mask for your mouth, covering your nose, and wearing eye protection. In addition, we really want to handle the equipment that's being used to treat us very sterilely, and we want to isolate patients who are infected with MRSA so they can not infect other patients, essentially. So now that you guys know a little bit about MRSA, hopefully you can keep yourself and those around you safe from this gruesome disease. So first, I discussed what MRSA is. Second, how I spoke about how MRSA is spread and symptoms to look out for. And lastly, I spoke about or explored different treatments and prevention of MRSA infection. So I hope I was able to educate you guys enough so you guys can be vigilant and keep yourselves and your loved ones safe from this horrible, horrible disease. So I just want to leave you guys with this. According to the CDC, approximately 5% of patients in the U.S. hospitals carry MRSA in their nose or in their mouth, or on their skin, I mean. So you should probably think twice before you start digging for gold in that nose of yours. So, thank you.